Hello, this is Practicing Nutrition Tech by Frederico. Hello, I'm Frederico, and it's my pleasure to speak to you about my adventures in using digital health in my career as a registered dietitian. Many of you may think that digital health is a relatively new phenomenon, but it actually has been around for decades. The Academy of Nutrition and Dietetic has 7 areas of practice. I'm going to go through each one and highlight some of the things that I've been doing in digital health. I'm going to move rather quickly, so at the end you might want to go back and review each slide. In clinical nutrition, I was a renal dietitian, and in 1986 we were beginning to use kinetic modeling calculators. In 2006, I was again a renal dietitian in the same position after having taken some time off, and we were using DOS computers to do electronic health record charting. It was painful. In 2008, I was at a brand new fitness center and I had 2 female clients who were interested in using their new iPhones, so we were using Lose It. 2010 to 2016, I've been acquiring a few items of my own, including a Fitbit, iPhone apps, Apple Watch, blood pressure cuffs, an Omron, and a pulsimeter. In community, in 1986, I began to get interested in cable television production. I had my own show called Nutrition Spotlight. 2003, I put together a book called NutritionVision based on a youth program that I'd been doing on Cape Cod of all our PSAs. In 2010, I found out about a game jam put on by Games for Health and the USDA and was matched with a programmer from MIT, and we put together the first prototype of my food focus game. In 2012, I took the 10 by 10 class and put together a project called Digital U for Seniors and actually tried it out in my local senior center in 2013. And just last year, I attended a Health 2.0 Codathon in Boston, and together with Emily Stone, we built NutriScripts, which was a nutrition EHR plugin. This is me in 2013 at a Games for Health program with the prototype of our game, Nom Nom. In the corporate realm, I had a business when I was at home raising children called Apron Strings. I taught myself publisher and digital photography and formalized my Frederico arts business in 2004 using a number of digital ways to manage the business with electronic filing, website development, and so on. I was also doing nutrition text alerts called Nutrition 411 for jivjiv.com. And for Zinnius, when I was working there in 2006 to 2008, I was helping put together corporate renal materials. These are some of the other projects that I have ongoing in my business called Frederico Arts, which are my ebooks, an app a day, my Happy Living magazine, and my ebook, Health Informatics Acronyms. These are some of the collaborative apps that I've worked on. In education, in 2009, I began teaching as an adjunct, and through 2015, I was at 4 different colleges in the Boston area, learning different learning management systems, how to do digital polls and surveys and do web quests and online exams. 2011, I was at Regis College when the campus became an all iPad campus, and out of that, in 2011, my son and I, my son is a teacher, wrote Managing the Digital Classroom. 2013, I was found online by people in China who invited me to their first global nutrition conference. It was a trip of a lifetime. I'm often asked to speak all over the country on digital health. In 2012 to 13, I was able to write 2 textbook chapters and supply app charts for Diabetes Organizer. In the food and culinary realm, I can use my iPad at home for digital cookbooks that have voice page turning control, search for recipes, and use my food photos. I can look at culinary magazines, and I took an edX food science course that I took right in my kitchen. And when all else fails, you can always use OpenTable. I also have a couple digital tools, the Prep Pad food scale and a Happy Fork, and can use my Apple Watch as a timer. Under management and apron strings, I was learning publisher and photography and putting them on CDs. In 2010 to 15, I was the honorary nutrition section chair for Games for Health, and they would let me manage a whole day of nutrition games every year. From 2010 to 2016, I was doing major app development, which I had to learn how to do wireframes and do doodle polls and work in wikis to work with my team who was all over the country. And in the research realm, I did a phosphorus study when I was a renal dietitian. 2015, I did a private practice EHR study. And in 2015 to 16, I was helping the Consumer Health Informatics work group at the Academy do a digital survey. 2014 to 15, I was involved in a nutrition research grant using iPads. In my future, I'll still be reading all about digital health wherever I can find it, and writing and developing more apps, managing my website and my business, consulting, creating and playing games, educating, snapping photos, and working on my iPad at my new office. Here's my contact information. Thank you for your interest and good luck in incorporating digital health into your practice.